Hi, my name is Pratik Taneja. I am 31 years old and I am presently sitting in Faridabad in Twacha by Saraswat clinic. And I'm serving in the armed forces. I had a long hair history since past 3-4 years, and I happen to have all these part of my temporal region going off, and it started off while back, like 3-4 years back, and I couldn't really find a treatment. I tried all the herbal and all gharelu treatments to really see if it can work, but none of it worked. And then I happened to find one of my cousins who got his treatment done from Twacha by Saraswat, and when I happened to see his results, they were pretty good, and that somehow gave me the confidence that okay, I can also go and get it checked for once at least and see if it will suit me as well. And I happened to reach here. The staff was really good, doctors and the other panel of members they have, that was really helpful and supportive to really help me out and discuss in detail basically how they do the procedure and how much graft they will be putting, and basically just to make me easy. And thereafter I was given a certain date to really go for the surgery or the procedure planned. And once I went through that, even during the procedure, I was made very comfortable. There was no discomfort that I faced in any case. And even thereafter, the medicines and everything, the entire process was pretty smooth out there. And it's been 6 months. I got it done in May 2023, and it's been more than 6 months that the results possibly are in front of you. And I, for myself, feel very different and very happy about getting this done, and feel very confident when I really move out in public right now. Earlier there would be the case wherein I would be very camera shy just because half of my face or half my head would be bald and I couldn't really see, couldn't really feel good in pictures. But now that is not the case anymore. I definitely am not anymore camera shy or to get clicked for that matter. So it was overall a wonderful experience with the team here, and even thereafter, after my surgery or my procedure, the follow-ups that I had with the team and constant follow-ups, they would be in constant touch with me to really ask me if I'm feeling right, and helping me out if I was stuck anywhere or if with any kind of medicine or any kind of procedure. So the staff was really cordial even after the surgery, and even today I have come to really meet the doctor, and I'm pretty satisfied with the entire service that has been provided to me. Thank you.
So you just listened to the 6 months results of Mr. Pratik, whose procedure we have done. In this video, we will discuss his planning, execution, and the precautions which we told him in detail. Hi, I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon and an American board certified hair restoration surgeon. In this field for more than 17 years and have done thousands of such hair transplant and have trained around 90 doctors in the field of hair transplant. Do subscribe to our channel for such useful videos which can be very life-changing for you. So when Mr. Pratik first came to us, he was having a hair loss of grade 3 Norwood male pattern baldness, and he had a preserved frontal tuft in this region. He had a thin frontal tuft here, and we did his trichoscopy. We also took his history and found out that he had taken some home remedies which were not very useful for him. Some medical treatments also were not very effective for him. And then we did a trichoscopy and we found out that his donor site density was around 80 follicular units per centimeter square. Average hair thickness was very good, around 0.08 millimeter, and he had in his donor site a good number of grafts available, and we were very happy after seeing his trichoscopy finding, which are mentioned on the screen here. Then we calculated his area which we have to cover. We found out that the area which we have to cover was approximately 95 centimeter square, and we planned a density of 35 follicular units per centimeter square because he had some hairs preserved existing in the hair fall region also. So with this we planned approximately 3,300 grafts for his hair transplant. If you are understanding the step-by-step planning in Mr. Pratik's case, please hit the like button. Then we did his investigations and planned his procedure. When he came for the procedure, we did his sensitivity or the checking of the allergy to any of the medicines which we are going to use during the procedure. We marked his hairline, and in this step we discussed his hairline with him and what were his expectations expectations, and we use a laser device to get very symmetrical hairline. After that, we trim the hairs. Then in the next surgical step, we give the local anesthesia part, which is a bit painful, and to prevent that painful sensation, we use vibration devices. The help of these vibration devices is that our brain perceives one sensation at a particular time, and this is known as gate theory. So gate opens for one type of fibers more. So we try to use the vibration sense for that. After giving a ring block all around the area from where we have to do the extraction and the implantation, then we do the slit making first. So for the slit making, we take care of the angle, direction, and the desired density, and then we make the slits in that area. While doing this, we have to be very careful that we are not damaging the skin. We are having an eye on the blood supply, and it should be adequate and sufficient. And then we do the graft harvesting. In Mr. Pratik's case, we did a FUE procedure. In this, we take one root individually using a low torque and low speed machine on which is mounted a handpiece, and on that handpiece we attach a punch which is 0.9 millimeter punch outside diameter, and the inner diameter is almost 0.65 millimeter. It's a sharp cylindrical punch, and the speed is so slow that every root can be centralized easily, and there is minimum to no damage if we are using a low speed machine. So the machine we use has a counter also which shows you the exact number of graft to maintain the transparency. This is very crucial and important because in hair transplant the charges of hair transplant go by the number of grafts which you are harvesting. After the grafts have been harvested, they are assessed or sorted or seen under a magnified image at the back table, and they are segregated or sorted into 1 hair, 2 hair, 3 hair, and 4 hair grafts. Then the insertion or the last step happens. In the graft insertion, we insert the 1 hair graft in the hairline, 2 or 3 rows. This is to make the hairline natural, because the natural hairline has single soft hairs in the front. If a hairline is very dense in the front with 2 or 3 or 4 hair graft, it looks very unnatural. So the graft insertion is done world over by the technical staff under the supervision of the operating doctor. This is the last step of the procedure, after which we discuss all the post-operative precautions and instructions in detail. So these instructions were shared with Mr. Pratik, and he was very comfortable during the procedure as well as after the procedure. When we were following him up, he was again very careful. If you are also planning your hair transplant, you can call us on the numbers given here, or you can write down in the comment section below if you are having a similar kind of problem. After giving all the instructions, as he had come on a very short leave, Mr. Pratik left for his services in the armed force. He could not come very regularly as we would like to do all our patients to come. Our dedicated team was following him and contacting him very regularly about his problems. If he was having honey, we were taking care of the things that he is taking his medical treatment properly or not. Now here you will see his before and after pictures, and also you will see his combing of the hairs, and you will see in this video how natural his hairs look and how naturally they have grown in these combings video on the screen. If you think that this is a useful video for you and the results are very natural and you yourself would like to have such kind of results, you can share this video with your friends and colleagues who themselves are planning for such a procedure. If you would like to know the cost of hair transplant and the various factors which influence the cost and why it varies from one clinic to another, you can watch the video on the screen.